I'm going to talk about imaging that we use for lumbar disc herniations or for lumbar radiculopathy. We start with x-rays. Typically with these patients, if they've failed more than 6 weeks of treatment, or if they've had pain for more than 6 weeks, we'll get x-rays. After x-rays, the next step is typically to get an MRI scan of the lumbar spine. And for those who cannot get an MRI scan, for instance, people who have had multiple prior surgeries and have a lot of screws, things can be difficult to see, we'll get a CT myogram. Or for patients who have a pacemaker or a spinal cord stimulator in place, we'll get a CT myogram. But typically we start with x-rays. What are the things that we look for in x-rays? Well, you want to look at the AP and lateral. And we want to make sure that there is no instability, that the alignment is okay, and also to see that there is no transitional anatomy. So in this patient, that's a normal looking lumbar segment count. So this patient has 5 lumbar segments, which we can see here overall. This one here, the next one has transitional anatomy. What do I mean by that? Well, you see here, this one is a rib, so this would be T12, and so then you have L1, L2, L3, L4, and L5 in fact is sacralized, because you can see here the transverse process is attaching to the sacrum here. So this L5 is sacralized, and you can see the same thing on the lateral, that this L5 is actually sacralized, and there's a very small disc here. So let me get rid of these markings. So again, here you see that L5 is sacralized. This is L5, and this patient then has only 4 lumbar segments that move instead of 5 lumbar segments. This is important for us to note for planning, especially if you're doing surgery, to make sure that you're going to be operating and you're on the right level. So that's transitional anatomy. It's not uncommon that you can see that the patients have kyphosis of the lumbar spine if they have large disc herniation, such as this guy. You can see he has a very large disc herniation here. And so this patient is really flexing or bending their back forwards to cause some relief over their symptoms. So they can have kyphosis because of pain. I've see patients who appear to have scoliosis because of the pain. Again, this patient has a large disc herniation here that is causing them, because of the pain, to tilt their spine to the other side. And so it looks like this patient has scoliosis, but really this is because of pain. Here's what a typical MRI scan looks like of a patient. This patient has an L5S1 disc herniation. The top image is the axial. You can see here, this is a large disc herniation that's pushing on the left side here on the nerves. And on the sagittal image, you can also then see this large disc herniation just pushing on the nerve. So this patient has an L5S1 disc herniation. The symptoms of the patients will depend on the location that the disc herniation is at. So there are 4 typical locations of the disc herniation. The first one is central disc herniation, such as this one here. The second one is a paracentral disc herniation, meaning that it's towards the side of the center. So this is a paracentral disc herniation. This is the most common location to have a disc herniation at. And typically, a paracentral disc herniation will compress on the traversing nerve root. The third one here is a foraminal disc herniation. You can see here it's actually outside here. This is the foraminal disc herniation in the foramen. And the last one here is the extraforaminal disc herniation, which is this one here, right outside of the foramen. The foraminal and the extraforaminal disc herniations compress the exiting nerve root. The paracentral disc herniation, which is this one, they compress the traversing nerve root, and that's an important distinction to know. And so here, to show that, this is a rough picture of the anatomy of a nerve. Essentially, if you're looking at the L4, L5 segment, so this is L4, this here is L5, the nerve that exits between L4 and L5 is the L4 nerve, which is this nerve coming out, okay? And the nerve that's traversing the L4, L5 segment is the L5 nerve. So this nerve, which I'm drawing right now, this is the L5 nerve that's crossing from the L4, L5 segment going to the next segment. Now, depending on the location of the disc herniation, you can either, now we're going to talk about the L4, L5 disc basically, okay? We're talking about the L4, L5 disc. So depending on the location of the disc herniation, it can either compress the L4 nerve or the L5 nerve. So for instance, if the patient has a paracentral disc herniation here, this is going to compress the L5 nerve. This is going to compress the L5 nerve. If the patient has a foraminal disc herniation is essentially going to be at this location. This will compress the L4 nerve. And if the disc herniation is extraforaminal, kind of outside here, this is going to compress also the L4 nerve. All right, so depending on the location of the disc herniation, it can compress different nerves.